Hello everyone, this is Dr. Viva. So today we will be discussing the signs associated with lobar collapses of the lung parenchyma. Okay, so we will only deal with the particular signs. We will not go in details. It is just for the FRCR shorts point of view. If you get any such case in the examination, you should be able to identify what are the signs associated with that particular type of collapses. Okay, so the first sign that we are going to discuss is golden S sign. But before going to the golden S sign, we should be knowing how the lung lobes are placed in the radiograph. So this is right upper lobe, this is right middle lobe, right lower lobe. Right upper lobe and right middle lobe is separated by minor fissure, which is also known as horizontal fissure. Right upper lobe and right lower lobe along with right middle lobe is separated by oblique fissure, which is known as major fissure. So there are two fissures on the right side. On the left side, there is only one fissure, that is a oblique fissure, major fissure. On the lateral radiograph, you can see right upper lobe and right middle lobe is separated by this horizontal fissure, and the this is the oblique fissure, major fissure, separating right upper lobe, right middle lobe from right lower lobe. So this is how the lung segments, the lung lobes of the both the lungs will appear on anatomical configuration. So this is right upper lobe, right middle lobe, and right lower lobe. This is left upper lobe and left lower lobe. Okay. Laterally, you can see right upper lobe, right middle lobe, and right lower lobe. This is left upper lobe and left lower lobe. So coming to the golden age sign, this is high yield as far as FRCR shots and also for FRCR Viva. So you should be able to identify how the golden S sign will appear on the chest radiograph. This is the schematic representation of the golden S sign. So golden S sign is basically reverse S. Okay, this is the reverse S, and there is inferior downward convexity at the region of hilum, and this sign is seen only in lung malignancy, bronchogenic carcinomas as the cause of right upper lobe collapse or right upper lobe atelectasis. So this convexity, inferior convexity, is because of the hilar mass, that is bronchogenic malignancy, and distally you can see there is concave inferiorly. This is secondary atelectasis. Okay, distal atelectasis. So that is the reason you are getting this particular sign on the chest radiograph. If you see medially downward convexity, so that means there is some central or hilar mass which is causing obstruction of right upper lobe bronchus, and secondary it is leading to collapse of the right upper lobe. Okay, so it is a characteristic downward bulge of the medial portion of superiorly displaced minor fissure, and this is also known as reverse S sign, like we discussed. Coming to the next sign, which is juxtaphrenic sign. So this is juxtaphrenic sign. So this is dome of diaphragm, and you can see this is triangular opacity with the apex pointing superiorly. Okay, so this is seen in upper lobe collapses, may also seen on the left side and right side as well. So basically seen is in upper lobe collapses. And how you can identify juxtaphrenic peak sign? So this is a small triangular peak projecting upwards from the diaphragm. Okay, and the cause of this sign is because of upward traction of inferior axillary accessory fissure. Okay, there is inferior accessory fissure in the right lower lobe, and because of the atelectasis of the right upper lobe, you can see overinflation, and because of the overinflation there is traction of the inferior accessory fissure. So that is the reason you are getting this sign. What are the other causes of juxtaphrenic peak sign? Could be due to parenchymal scar, or could be due to extrapleural fat drawn into a reoriented major fissure. Okay, it is predominantly seen on the left side. 75% of cases can also be seen on the right side, which is 67% of cases. What is flat waist sign? So this is a flat waist sign. Okay, so because as the name suggests, there is a flat waist. So normally because of the aortic knuckle and pulmonary bay, there is undulation over there, and because of the left lower lobe collapse, you cannot see that undulation, and that is the reason we call it as a flat waist sign. Okay, so normally there is a convex contour of the left mediastinum becomes flattened. Okay, normally the convex contour of the left mediastinum becomes flattened in flat waist sign, seen in left lower lobe collapse, seen when there is a flattening of contours of the aortic knob and left main pulmonary artery. Okay, There is leftward displacement and rotation of the heart. So heart might be displaced left side and seen in severe cases of left lower lobe collapse. Okay. Coming to the next sign, which is a upper triangle sign. So this is the upper triangle sign. What is upper triangle sign? Basically a triangular opacity along the right upper mediastinal border. Okay, right upper mediastinal border, that is a upper triangle sign seen in lower lobe collapses. So why in the lower lobe collapse we are getting this upper lobe triangle sign? Because of the overinflation of the right upper lobe, and because of the overinflation there is ipsilateral displacement of the anterior junction line because of the collapse of the right lower lobe. Okay, because of the collapse of the right lower lobe there is ipsilateral displacement of the anterior junction line, and because of this anterior junction line this is displaced ipsilaterally, and that is the reason you are getting this upper triangle sign. Understood? Coming to the next most important sign, what is Luftschild sign? So Luftschild sign is basically seen in left upper lobe collapses. So because of the left upper lobe collapse, you can see a wheel-like opacity like we discussed in the previous lecture. So in the wheel-like opacity, you see increased opacity at the region of hilum and then fading opacity towards the periphery. And because of the left upper lobe collapse, there is overinflation of the left lower lobe. And you can see this crescentric lucency at in between aortic knuckle and collapse portion of the left upper lobe, and this is because of the overinflation of the superior segment of left lower lobe. This appears as a lucent sickle shaped band adjacent to the aortic arch. Okay, like we discussed, a radiolucent stripe between the mediastinum and the opacity of the collapse lobe due to invagination between the structures of the overinflated superior segment of the lower lobe. Okay, so on the radiograph, we can see on the CT scan, this is how Luftschild sign will look like. This is the collapsed left upper lobe, and this is overinflated superior segment of the left lower lobe. Okay, this is also seen as a V-shaped or peaked appearance of the posteromedial aspect of the upper lobe collapse with compensatory overinflation of the superior segment of the left lower lobe that we discussed. Coming to the, I think this is the last sign we are going to discuss, shifting granuloma sign. So shifting, so once you have a previous imaging, previous radiograph or CT scan, and you know that there is a granuloma. Okay, so here it looks like this is the major fissure. This looks like there is a granuloma in the superior segment of left lower lobe, and because of the collapse, you can see the displacement of the granuloma or might be disappearance of the granuloma. Okay, so can be seen in any type of lobar collapses. This is unusual finding occurs when a solitary pulmonary nodule shifts or disappears from one examination to another. Okay, so once you encounter any collapse, so this is left upper lobe collapse. Now in this area, you cannot see any granuloma. Okay, so the granuloma might be within the collapsed lung segment. Okay, or could be you can also see shifting of the granuloma. This on the basis of CT scan, it is difficult to identify where is the major fissure. This may be still in the apicoposterior segment of left upper lobe. So after the collapse, you are not able to see the granuloma. Okay, so this is shifting granuloma sign. Yeah, coming to the last sign, that is Silhouette sign. Silhouette sign is the most important sign in chest radiology. It helps you in identifying many different conditions. Okay, from masses, from nodules, from collapses. So you should be knowing Silhouette sign in detail. So what is Silhouette sign? Silhouette sign is basically a loss of normal border between structures of similar density. So you should be knowing that there is a loss of Silhouette only when the two adjacent structures will have similar density. If two adjacent structures have different density, then still there will be good demarcation between the borders. Okay, then the Silhouette sign will not be seen. So Silhouette sign will only be seen when the two adjacent structures will have similar density. So it will be difficult for you to identify one structure from another. Okay, helps in localization of collapse. So today, since this lecture is only limited to collapse part, so I am only covering collapse portion. So on frontal radiograph, you can see if there is a right middle lobe collapse, then it will obscure right heart border, like we discussed before. If there is a lingular collapse, it will obscure left heart border. Okay, if there is a right upper lobe collapse, then it will obscure ascending aorta and SVC border, right lateral border of ascending aorta and SVC. If there is lower lobe collapse, then it will obscure diaphragm. Okay, we have seen in the previous lecture that how lower lobe collapse will obscure diaphragm, and it will be difficult to identify the dome of diaphragms in particular type of lower lobe collapses. So how the silhouette sign will appear on the lateral radiograph? On lateral radiograph, if there is, you are not able to identify posterior border of the heart or posterior left hemidiaphragm, then you should suspect left lower lobe collapse. Okay. If you are not able to identify anterior portion of right hemidiaphragm anterior portion, okay, so that could be because of the right middle lobe collapse. If you are not able to identify posterior portion of the right hemidiaphragm, then that is because of the right lower lobe collapse. So I think that is it, guys. So we are done with lung collapses. We have also discussed associated pertinent signs in lung collapses, such as golden S sign, Luftschild sign, and silhouette sign. So these three signs are most important, can be asked in Viva part of examination, also in FRCR shorts. So you should be knowing which, if there is any loss of silhouette of particular structure, then you should be able to say which lobar collapse you are dealing with. Okay. So thank you, guys. We'll end the respiratory system over here, and we'll go to not the respiratory system, we'll end the lung pathologies. Okay. In the next lecture, we might discuss about pleural pathology such as effusion, then pneumothoracis, hydropneumothoracis, how to identify deep sulcus sign on the radiographs. Okay. Thank you, guys. Good day.